I guess we'll go ahead and just get started then. It's about 3 o'clock, so I know I'm suffering from a little bit of a post Philly cheesesteak sleep here. We'll try to keep everyone awake for the next 20 minutes here. Really appreciate everyone coming. My name is Matt Chin. I am an associate professor of emergency medicine over at the Medical College of Wisconsin in Milwaukee, and we are here to present what our talk entitled Battleground Emergency Department, really looking at the critical role of hospital security. And here to co-present with me is Maya.
Hi, everyone. I'm Myron Love. I am the Director of Security, Safety, Emergency Management, and Business Continuity for Freighter Theta Care Health in Wisconsin.
Awesome. So no disclosures for us. And then just wanted to start off with a bit of an introduction so you can compare maybe where you practice to where we are. So we are, again, located in Milwaukee, Wisconsin. So we serve an area about 1.5 million people. We are a kind of tertiary level 1 academic emergency department, so about 750 bed hospital located just on the outskirts of the city of Milwaukee, actually in the city of Wauwatosa, which is an adjacent suburban community. But that's kind of what we look like. We are an academic department, full and complete with residencies of all assorted types. And we are seeing about 80,000 patients a year in our emergency department, so somewhere between 230 and 250 patients per day. We see a significant amount of trauma as well at our facility as a level 1 trauma center. We take about 2,500 trauma activations a year, about 25% of those being penetrating trauma. So we significant amount of kind of trauma at our facility just as a baseline. So as we walk through this, just wanted to give you an idea of what we hope to get accomplished by the end of this. Really just looking to discuss and share data on the need to mitigate healthcare workplace violence. And so we'll have a couple slides on subsequent coming up that kind of explain that. I think everyone in here probably is intimately knowledgeable about what that looks like on a day-to-day basis as you practice in an emergency department. We're going to talk about resources and healthcare security industry guidelines and research. So Myron will specifically talk about the International Association of Healthcare Security and Safety, which provides some guidelines for healthcare security with regards to the emergency department. We'll discuss some ED best practice guidelines to really maintain emergency department safety. We'll talk a little bit on the final slides about our internal experience with kind of managing safety and security for our emergency department, give you some real life examples of things that happen in our emergency department and what we've done to address those from a safety and security perspective. And then obviously discuss strategies to drive collaboration between our interdisciplinary teams, obviously our security colleagues and our emergency department staff. So as a background here, safety in the emergency department is critical to both staff and patients. Studies show, as you have all known, that physicians, nurses, staff really experience some of the highest rates of any workplace in terms of kind of violence. Previous studies have really shown that over 80% of nurses, about 80% of physicians have been victims of physical assault within the past year. Those that are victims of verbal assault probably are well above that number as well. Weapons further exacerbate this risk, so we'll take some time to really specifically talk about weapons safety in emergency departments. We'll kind of, again, hit on those particular tactics. We'll show you, again, the Cleveland Clinic has published about 30,000 weapons they confiscated from patients and visitors in 2023 across all of their sites as a background here. So we have a pretty small group, so if you feel comfortable, we'd just be interested to see how many people have experienced like verbal or physical violence or assault in the past 12 months in their work experience. So I think... the pull everywhere was my attempt to be really cutesy with this, but it doesn't pull up here. So we're just going to do it by hands here. So it looked like at least half the room, which kind of goes with the statistics that we've seen here, maybe more than half the room actually, which is consistent with what we've seen from physicians, which is about 80% have been assaulted in the past year. So I'm going to transition over to Myron. He's going to talk a little bit about healthcare security best practices.
Thank you very much, Dr. Chin. So what I was hoping to do today is give you all some excellent resources that you could use to take forward. In addition to my role at Freighter Theta Care Health, I am also on the board of directors for a couple of our nation's largest healthcare and physical security associations. So the first one I wanted to bring to your attention was the International Association for Healthcare Security and Safety. Excuse me. So IHSS is an organization that has done a lot of work benchmarking and looking to establish best practices and guidelines for healthcare security. Specifically for emergency departments, we have developed the security design guidelines for healthcare facilities and the healthcare security industry guidelines. what we have done is try to make a one-stop shop for medical providers to see information that has been created in collaboration with the Emergency Nurses Association, the American Hospital Association, other organizations like the National Center for Missing and Exploited Children. So as these organizations work to develop workplace violence guidelines and practices, they collaborate with the International Association for Healthcare Safety and Security. Some of the current work that we're doing right now is building a national guideline on sex trafficking and how clinicians and medical staff can bring in more healthcare security and safety concepts into how we're managing those patients. We're establishing a national standard on weapons screening and detection for healthcare facilities, some of which I will go over a little bit in more detail. And the work is just amazing. I've been a part of this particular organization for about 20 years now, and I'm happy to say that as we've seen some of these unfortunate national trends in workplace violence against healthcare workers increase, and we've seen a lot of states start developing their own laws around workplace violence prevention for healthcare workers. They've been working with IHSS to help establish some of these standards. We're also working with some of our national organizations. Vizient, for example, has been working very closely with us to help establish benchmarks and metrics that healthcare organizations can use to kind of level set against each other to make benchmarking a lot more easy. We also published the Journal of Healthcare Protection Management, which is a peer-reviewed journal where healthcare security experts are able to submit their own best practices from their organizations. For example, this is one of our most recent ones where we talked about the culture of security and safety in healthcare, fostering meaningful collaborations between medical, clinical, and security staff, and enhancing healthcare security with concealed weapons screening and visitor management, and how and why they affect that everyday experience for patients. With the understanding that the more security you put in, the greater impact you're going to see when it comes to patient experience and that whole concept of how they feel about that organization. So the International Association for Healthcare Security and Safety Foundation is also leading a charge to develop high levels of education, research, and developing a healthcare security and safety body of knowledge. So we have a healthcare crime survey. So I believe at our last 2023 healthcare crime survey, we had over 100 of the nation's largest providers, their security and safety departments submitted information. So with this healthcare crime survey, we've been able to, show best practices. What are the other organizations doing? Something that I'm sure you've heard in your organizations, or what are the other hospitals doing? So we try to look for like-to-like comparative data analysis and give recommendations on how you can apply physical security, as well as writing white papers. For example, we have the impact of body-worn cameras in hospitals, an in-depth study. So this one was done in collaboration with the FBI. So we worked with them to pull a lot of data that they were seeing in healthcare organization, active shooter situations, armed assailant, and look at how we are able to make recommendations for body cameras on how to help with some of the response and investigation that may need to take place with that. And we also have the National Healthcare Security Incident Benchmarking Dashboard, which just launched this year. So this is another fantastic way that we're trying to spread awareness to have individual hospitals participate in this. The emergency department design guidelines that I spoke about has different sections. For example, this one is an excerpt from the Buildings and Internal Environment Emergency Department section. So the concept for an emergency department is to look at it as a secured area with an added layer of protection between a healthcare facility, public areas, and a treatment facilities. As we've seen a lot of hospitals start moving towards more of that open environment where you want a lot of natural sunlight and you want to have your clients, patients, visitors feel kind of inclusive, that does not always play well with the need to protect staff against some of those threats. We see this a lot with registration areas where security might recommend more high-level glass to avoid people going over the desk, because unfortunately that does happen. But you also don't want it to feel like, a bank teller window or you're in a prison. As we start talking about weapons screening and weapons detection, that really comes into play, because once you start putting in more of those overt systems, that can really make people, it's kind of counterintuitive because you're putting more in place to make people feel safe, but it causes people to wonder, okay, well, what's going on here that you need all of this extra security? So we recommend that you develop a comprehensive security plan that integrates an understanding of the ED functions in the populations you serve. So we're talking forensic patients, behavioral health patients. Some hospitals have a detox and overdose area, etc. So it's a layered approach. And as you can see in this really good graphic, it's just an example of how this organization may have used like their main emergency department treatment area separate from behavioral health. Because you're dealing with different patient populations, obviously sometimes it's not best to mix populations. You need to have the ability to separate your visitor and your lobby area from that patient care area, but you also need to have a way to facilitate patient care and access for your visitors to get to people. So for security, there's a need to make sure that each one of these areas is looked at as a compartmentalized system with varying levels of access control might be necessary. That comes into play when we're talking about our trauma bays, where not all staff members should have access to the trauma bay, because sometimes you'll have staff that just, it's interesting and they may not necessarily be part of that response team to that trauma, but they're in the area, they have access because they work in ED, but sometimes that can compromise the ability to efficiently provide care because you've got too many people there. In some places, I've seen that set up where you may have, your respiratory techs may have access, but not all of your pharmacy staff may have access, for example. Thank you.
So we talk about best practices kind of as a summary of this. So some things to consider: ambulance and walk-in entrance generally should be clearly marked and have some distinction between the two. As Myron was talking about, the kind of walk-in entrances generally are considered more public areas, whereas often the ambulance entrances are direct into the treatment care spaces of your emergency department. So having some visual separation between those two is something that's considered best practice when you're designing the physical space of an emergency department. You also want to avoid kind of pedestrian and vehicle traffic conflicts at the front. Some other considerations are to potentially angle the way that your emergency department walk-in entrance angles towards streets. So to avoid vehicles kind of ramming there, there's often consideration for the angle of that entrance, as well as placement of bollards or large planters or other things in front to prevent people from taking vehicles into the front of your emergency department. It's an unfortunate but reality of the situation. All the areas of kind of public access, the parking, the waiting room, ambulance bays, they should all be well lit. And the recommendation is obviously there should be video and communication equipment that's stationed in all of those particular areas. When we think about access to the hospital, like Myron talked about, the ED should be controlled to the highest degree possible. You want to allow and permit patient care to occur, but you also want to prevent people coming from public spaces like the waiting room into the treatment areas without having the correct authorization to do that. So badge readers are a common way to do that, to kind of be able to restrict access between different areas in the emergency department. We should be able to kind of restrict access to the ED and have live video imaging of people entering and exiting that as well. Ambulance entrances, again, should be restricted to really just EMS vehicles to be able to come into that particular space and not allow walk-in traffic to enter through your emergency department ambulance bay. And physical security space needs to be considered for screening. So whether that's what we're going to talk about in the next several slides, which is some weapon screening technology, or however you position your security at the front to do any sort of screening, make sure that you have adequate space to be able to perform those things as people come in. Considering storage for weapons and patients' valuables, medical supplies, as was my common sense, should be kind of secured away from public spaces. And then things to consider in your waiting room really are having visitor comforts, bathrooms, and telephones, but also thinking through the amenities that you offer there. So even things like furniture considerations. So we always consider the use of singular or small pieces of furniture as being not ideal in emergency department waiting space. Anything that you can pick up or throw or use as a weapon. So using furniture that's either anchored to the ground ground or heavy or multiple kind of seating furniture that just can't be lifted or thrown is preferred over singular pieces of end tables or singular chairs. And then things fastened to the wall should be fastened more securely than you might at your home with just a picture hanger, so that they can't be removed off the wall and again used as weapons or thrown at people. Avoiding coat hooks, other things that protrude from the wall, or other considerations that you should have when you're installing hardware in your emergency department waiting rooms. Security workstations should have visibility from triage and the waiting room with a good line of sight. Like Myron mentioned before, kind of ensuring work areas are the heightened strength to make it difficult for someone to jump over that, depending on your individual security analysis, whether you need bullet-resistant glass or something else in addition to just these physical factors is something to consider as well too. And then access to medical treatment areas, again, should be restricted as much as possible. So we're just going to talk a little bit about weapon screening as well. Just again, just from hands in the audience, who here has their facility using a magnetometer? So your traditional thing that you see over at the airport. So great, about 40% of the room here. Anybody use anything else like Evolve or Open Gate? So those kind of passive weapon screening. I see some nods as well, some hands in the back. Anybody still using old school X-ray machines, putting bags or things through that? Not anybody here. Looks like physical belonging search. Do your officers do kind of physical search of bags or anything like that? I see some more hands. And then does anybody not have any screening at their emergency department? I see some hands there as well too. So I'll turn it over to Myron here. He's just going to give a brief kind of overview of some weapon screening technology.
Yep. And in the interest of time, I'm not going to go into too much detail on these, but at the end, if you have any questions, we can definitely hit those. So weapon screening is defined as the processor technology used to detect concealed weapons or dangerous items. This does not always mean firearms, and that is something that we've talked about a lot in my experience at hospitals when we talk about the need to do weapon screening or contraband detection. A lot of it is around that concept of firearms, but we should keep in mind that firearms in many cases are going to be the least of what comes into an emergency department. For example, at our emergency department, or actually at Freighter Hospital, we screened 167,000 individuals last year and recovered around 1,800 individual pieces of contraband, which does include weapons. We did have a number of firearms that came in that were caught in our emergency department bay, which Dr. Chin will talk about later. But the vast majority of the items that we were seeing that could be used to cause harm to a caregiver or a patient were some of those little less overt items. So we're talking razor blades, pocket knives. In the state of Wisconsin, where we have a lot of people with concealed carry permits, you may see a lot of individuals with firearms that would not be allowed to come in. We track that data separately to show how many people we explained you can't bring that firearm in, but you can take it back and do something else with it, but you can't bring it in. In most cases, they are allowed to store that item in their vehicle. Although we don't tell them to store that in their vehicle because we're also not responsible for what happens to that vehicle. The technologies that we're using can be non-invasive or invasive. Some examples of that non-invasive technology are the magnometers, or that are the metal detectors. There's benefits. For the most part, they're considered non-invasive from a physical standpoint to the individual, and they can be visibly discreet. But they do have some limitations. Mostly it's around space, because sometimes these pieces of equipment can be rather large. Some more invasive technology. A good example is the millimeter wave scanners. This is what's used at the airport where they're actually doing a body scan. We have artificial intelligence. Our organization is looking into a hybrid model with this, where we are using the Evolve system, but we're also looking at another system that would be able to integrate with our video management system, and we'll be able to use AI for visible detection of objects that may be a weapon that we can notify security for an interception.
And like I said at the beginning, we'll kind of summarize. So we had a magnetometer, handheld wands at our walk-in entrances initially. We did not do EMS weapon screening, so patients coming in through our ambulance bay weren't screened. From December of 2023 into April 2024, we discovered 3 firearms, 1 set of razor blades, and a butcher knife on patients in our clinical areas. All of those patients arrived through our EMS entrance, and therefore were not screened for weapons upon arrival. So Myron will talk a little bit about kind of implementation of a program recently.
Right. So this has been an evolution at our organization. So previously, we mostly focused on our emergency department entrance, but we were not screening everyone coming in through our EMS bay. That screening happened inside of our trauma bay, where we would normally find some of those items and security would retrieve them. But now we do a more proactive approach. So anyone that's coming in EMS, they're screened inside of our ambulance bay. Because we know that is just one point of entry into organization, we've also started to identify locations throughout our hospital that we can secure with weapon screening. So our main skywalk entrance coming off one of our visitor parking garages, we have the Evolve system. Hospital's currently under construction, so we have a new main entrance where we are now doing weapon screening there as well. So the numbers of individuals that we're screening has gone up dramatically. However, the number of weapons that we're seeing coming in have not, because as our populations got more used to the idea that they will be screened and seeing our visible signage and just kind of making it part of that check-in process, we're seeing a lot more compliance or people just simply not bringing in certain contraband items in.
And we'll close pretty quickly here. Just some general recommendations for having a good working relationship. So regular meetings between emergency department and Myron's team has been a key part of how we've been able to do this. So we've brought concerns to his team. We're able to close that loop relatively quickly with kind of monthly scheduled meetings. We have objective benchmarks on KPIs to increase transparency and collaboration. We foster a team-based approach, and that includes everything from wellness and training activities to simulation between staffs from both of our departments and all of our disciplines. And then obviously encouraging clear and transparent communication. And with that, I think we're at time here. We're happy to stick around and answer any questions. We appreciate everyone's attendance.
Thank you very much.